medical jurisprudence called ka definition bhaneko thiye हैन. So again alikati detail ma jandakiri what is medical jurisprudence and deals with the legal responsibilities of a doctor with particular reference to those arising from doctor patient relationship. Now अहिलेको एकदम issue पहिला त यति highlight मा आउँदैन थियो हैन about medical negligence. अब कुनै पनि if patient has died, even if it's a natural disease and natural cause ले मरे पनि there are cases where patient party issue गर्छ doctors को against मा complain गर्छ medical negligence को cases हरुमा. You have been hearing about these cases. Alright, so medical jurisprudence is a part of forensic medicine where you talk about the legal responsibilities of a doctor. You know, as you get the title doctor, I know medical school ma chhau timaru 5th year sakyepachi, when you complete your final year, when you complete your internship and you become a registered medical doctor, you'll have some responsibilities. I know rights and responsibilities, okay, responsibility towards your patient. All right. So, what are the legal responsibilities of a doctor after doctor-patient relationship gets established? So, if you're taking care of a patient, then immediately this relationship arises. That is doctor-patient relationship. Our relationship हुने बित्तिकै कुनैको पनि contract हुने बित्तिकै there can be various conflicts हुन सक्छ, medical negligence को conflicts हुन सक्छ. त्यो सँगसँगै consent को कुरा आउँछ हैन, which is very important. तिमीलाई अहिले सुरुमा सबै subject मा त्यही सिकाइरा होला. Before examining a patient, you have to take consent. Okay, so consent को पनि धेरै criteria हुन्छ. It depends upon the age. Okay, if the patient is capable of giving consent or not, if a patient is not mentally sound, or a patient is minor, age le garda minor छ, and you are taking a consent, then that consent becomes invalid. Alright, so you will be learning about what is consent, what are the types of consent, when the consent is valid, when the consent is invalid. So these are included in medical jurisprudence. अर्को कुरा आयो मैले अघि भने legal responsibilities भनेको duties of a doctor and rights पनि हुन्छ तिमीहरुको हैन. So that's a good news actually. Duty मात्र गर्नु परेन, right पनि भयो. के right भयो भन्दाखेरि if you are examining a patient, you have right to claim fees, for the work you have done. So that is your right. I'm just giving you one example. All right. So there are various rights as well as various duties of doctor. Professional misconduct ones. There are certain list of professional misconduct which is listed in your books, in your code of conducts, which you'll be reading further in medical jurisprudence. Now, ke garyo bhane chai professional misconduct. Again, one example: a doctor is intoxicated with alcohol, may it be alcohol or some kind of a substance abuse, and goes to a doctor. Goes to a patient to examine. No? That becomes professional misconduct. All right. And finally, medical ethics. Okay, you have to know what is medical ethics, what are the principles of medical ethics. Okay, and what are the doctrines? There are certain law regarding doctor and patient. So we call that as doctrine. Law to laws of Islam, doctrine once. So you have to know various doctrines as well. Next is forensic odontology. I think this will be our, okay. We'll just know about the subject and end the class today. Next class now we'll be talking about the medical legal system of our country. All right. So odontology bhane pani euta branch bhayo. What do we mean by forensic odontology, which is also known as forensic dentistry? Okay. Now these days, for identification, this is very, very important. Okay, these days matra, it started long time back, but now people are more focusing on forensic odontology because identification is more accurate by examining dental examination. Okay, so odontology bhaneko ke ho bhanda proper handling, examination and evaluation of dental evidences. And you'll get dental evidences For example, in case of air crash, air crash, it's very important for identification. If the there is a mass disaster, identification is very, very difficult. This body logio, autopsy dozens of body, hundreds of body. Doctor first asks for any kind of dental evidences, X-ray radiographs, अथवा any kind of photographs is there, with a smiling face, so that it's easy to compare and identify the victim. All right. So you have to examine, you have to evaluate the evidences, antemortem evidence or postmortem evidence. Don't get confused. Antemortem when the person was living, what are the evidences? Radiograph, photographs, you collect that, and whatever evidences you collected after examining the body, you collect that and then compare that. Okay, and after that, you draw out the opinion. Is it matching? Is it not matching? If it's not matching, what is the other possible matches? You calculate that and then finally give identification. Now, odontologist ko kaam ke ho? Identify human remains, identify bodies in mass disaster. So, whenever odontological roles of an important mass disaster also, also important role ka answer examination of bite mark injuries, which is more common in sexual assault cases. Not just bite mark is present in the victim, but it is present as well as in the accused. Victim accused like bite also. So you can examine the bite mark, estimate the age of the skeletal remains. Okay, so these are the roles of odontologist. अर्को आयो forensic psychiatry. Again, very important topic. अब सबैभन्दा तिमीहरूलाई गाह्रो हुने टपिक नै forensic psychiatry हुन्छ, किनभने अलिअलि नलेज तिमीहरूलाई पहिला बेसिक साइन्समा भइसकेको छ, अलिअलि नलेज तिमीहरूको यो थर्ड इयरमा मेडिसिनमा, सर्जरीमा, पेडियाट्रिकमा सबै इन्क्लुड हुँदै आउँछ, गाइनेकोलोजीमा, सेक्सुअल असल्ट भेरी इम्पोर्टेन्ट सबै हुन्छ, तर साइकियाट्री एउटा तिमीहरूको फोर्थ इयरमा हुने रहेछ हैन. सो साइकियाट्रीको नलेजै पनि भइसक्या भए फोरेन्सिक साइकियाट्री पढ्न सजिलो हुन्थ्यो तिमीहरूलाई. Since you don't have any knowledge on psychiatry, it will be very difficult. This chapter will be very difficult. त्यसैले पनि मैले तीनटा टपिक चाहिँ साइकियाट्रीमा राखेको छु. एउटा बेसिक्स अफ साइकियाट्री, at least minimum knowledge you have to know to understand forensic psychiatry. त्यो टपिक राखेको छु. अनि फर्दर अर्को दुईटा चाहिँ legal, medical on legal issues related with forensic psychiatry. So that is how I have planned for your classes. त्यसैले गर्दा forensic psychiatry अलि गाह्रो हुन्छ है, तर if you can read and understand this topic, it's easier for you to score more marks. So please be sincere with this topic as well. So psychiatry के हुन्छ? Insanity in cases of murder, competency as a witness, testamentary capacity in executing a will, and validity of consent. यहाँ पनि हाम्रो consent को कुरा हुन्छ. कोही mentally ill छ अथवा unsoundness of mind छ भने cannot give consent. Okay, insanity in case of murder, if there is any cases of murder, was that accused mentally sound or not? If a person is mentally not sound, then he can be not liable for the act he has done. Okay, if it's proved that the person did due to his insanity, if he caused murder or homicide due to his insanity, he will be excused of the crime he has done. So we have to rule out that as well. Competency as a witness, witness ko lagi ya consent ko lagi, or testamentary capacity bhaneko after that timle kolai diन्छौ तिम्रो property भनेर will बनाउनेलाई testamentary capacity भन्छौँ हामी हैन. So यो सबै कुराको लागि forensic psychiatry is important. Lastly, I think no, not last, second last. So forensic anthropology भनेर हाम्रो branch एउटा छ that is assist in identification of a deceased individual whose remains are decomposed, burned, mutilated, and or otherwise unrecognizable. All right, so mutilated भने बुझ्यो?
Cut marks or त्यस्तोहरु स्टडी
Earth marks, mutility भनेको mutilation भनेको त्यही अलिकति तिमीहरु कन्फ्युज हुन्छ है. If a body is badly cut into pieces, हैन, अनि कुनै piece कता फ्याक्दै हुन्छ, अब of course the person who committed homicide doesn't want any kind of evidences, so he will cut the body into pieces and throw the pieces of body in various places, that is mutilated. कहिलेका एउटै पिसमा एउटै बडीको पार्टमा पनि हुन सक्छ, that is mutilated body हुन सक्छ. नै यसमा पनि identification is difficult. If the body is decomposed and skeletonization has occurred, then again identification is difficult. Burned, again it is difficult. So the work of anthropologist is to identify the pieces of a body and then identify the person at the end. So this is related with forensic anthropology. Now, finally, a branch that is known as forensic serology, which is detection, classification, study of various bodily fluids. So, rape victim by examining the bite mark, you can collect saliva swab. Even you can collect blood, sweat, semen, urine, fecal matter. These are all collected, various bodily fluids, and these are sent for lab investigation. And if it is related with the crime scene or not, that can be identified. This is under forensic serology. अब हाम्रो करिकुलममा forensic serology त्यति छैन हैन, but again I would like you to understand basics that is required. For example, blood is very important, semen is very important, saliva is very important. So few topics, it is important because it's not just related यो serology पढ्नु पर्छ भनेर मात्र हैन, because it is related with rape, sexual assault को लागि. So basics you have to know. So that is all for today. I think 8 minutes is left. So if you have got any query, you can ask me, or if you want me to repeat anything.
Ma'am, point number E छुटे जस्तो छ.
Point number
E.
E.
हजुर ma'am.
See, हैन D र E नै छैन रहेछ कि यो स्लाइडमा. खास मैले अघि तिमीलाई अर्कै स्लाइड देखाइराथे, त्यो कता गयो अनि त्यसको कन्टिन्युएसन यो मैले अर्को स्लाइडबाट देखाएँ, but I don't think I missed out any slides. But still, if I find that anything has been missed, I'll continue in next class. अघिको स्लाइड कता हरायो कि है?
Ma'am, the medical ethics वाला टपिक को थियो.
Ethics वाला थियो.
हजुर, त्यो फर्स्टमा देखाउँदाखेरि सेकेन्ड सेसन हुँदाखेरि देखिरहेको थियो अनि पछि
त्यो होला.
यस मैम, यही हो.
यो माथि तल परेर रहेछ. ल बुझेँ ल. ईमा ethics भनेको it deals with the moral principles which guide member of medical professions in dealing with each other, patient and state. Ethics मा के include हुन्छ भन्दाखेरि all the principles are there on medical ethics. All clear हुन्छ पछि ethics पढ्दाखेरि, and there are certain principles, theories for medical ethics. त्यसले के हेल्प गर्छ तिमीलाई? कोड अफ कन्डक्ट हुन्छ. के हेल्प गर्छ भन्दा how do you deal with each other. पहिला सुरु आफ्नो colleagues सँग कसरी, आफ्नो friends and colleagues सँग, आफ्नो seniors and juniors सँग, हैन, कसरी deal गर्ने. Okay, so code of conduct ले त्यो define गरेको छ एउटा. Patient सँग कसरी deal गर्ने, what are the conducts regarding patient, हैन, कसरी deal गर्ने. अनि state सँग, state भनेको country, तिम्रो आफ्नो country सँग तिम्रो के liabilities हरु हुन्छ, duties के हरु हुन्छ, हैन. अब कुनै पनि अब medical ethics के भन्छ भने patient को secrets हरु भन्नु हुँदैन, अर्को certain अर्को मान्छेलाई अथवा कसैलाई पनि उसको professional secrecy मा हुन्छ, हैन, secrets हरु भन्नु भएन, हैन, what the patient has confided on you. Okay, but again, if it is a criminal case, okay, if that patient has committed some kind of murder or any kind of criminal activities, acted criminally, and came for medical examination, and by examining that patient, you know that some kind of criminal action has been done, then it is your duty to report it to the police, in a state one, police through nahi. Okay, so what are the duties towards your state? So this has been defined in medical ethics, right? Orko ayo medical etiquette. Medical etiquette, it deals with the conventional laws of courtesy observed between members of the medical professions. Okay, so what is the duty towards your colleagues? Abo colleague ko ma, timro sathi ko ma, I'll give you two examples. Aman ra Abhishek ko ma, Aman ko ma patient आयो, अभिषेकलाई रिस उठ्यो, ओहो उसकोमा मात्र पेशेन्ट जाने भनेर अभिषेकले चाहिँ अमनको अगेन्स्टमा, हैन, उसको रेपुटेसन ड्यामेज गर्ने गरिकन उ त राम्रो डाक्टर हैन है, उ त क्वालिफाइड हैन भनेर अभिषेकले अमनलाई उसको रेपुटेसनमा हार्म गर्नु, हैन, हुन सक्छ. द्याट क्यान बी पोसिबल. अहिले तिमीहरु फ्रेन्ड्स छौ, भोलि पर्सि प्रोफेसनल्स भएपछि राइभल्स हुन सक्छौ, हैन. So what are the conventional laws of courtesy that has also been defined in council को हाम्रो code of conduct मा. Okay, WHO ले पनि define गरेको छ, code of conduct मा पनि define गरेको छ. Okay, so that is medical etiquette. Okay, deals with the conventional laws of courtesy observed between members of medical professions. Is medical etiquette. So I think I've covered it all now. Oh, के नबुझेको छ? यही स्लाइड रहेछ, माथि तल भएकोले I got confused. ठिकै छ, सी डी अझै छैन, कता गयो? Alright.
मैम डी पनि दियो.
ल अहिले बुझ्यो होला नि, हैन, ब्रान्चेस त बुझ्यो. I hope I was clear. केही नबुझेको छ? Let me know, all right, if you're not clear. And then next topic, we'll start a little bit about history of forensic medicine. Further, we'll go into legal system of our country. Okay, so that's it for now. Please send me attendance. I'll see you on next Wednesday because this Friday I'll be on leave. Okay. Okay, bye-bye.
Thank you, ma'am.
Thank you, ma'am. Have a nice day.
Thank you. Same to you.